an introduction of what POR is and patient engagement is, and then we'll go through the slides. So I will pass the baton to you guys, and thank you for the participants to join us today.
Hi, thank you so much, Maria, for that introduction. I just wanted to let everyone know that I have started recording, but again, I will stop recording during the Q&A session.
Thank you, Amber. So good afternoon, everyone, and welcome to, as Maria said, the first in our monthly conversations that center on patient engagement and patient-oriented research topics, hosted by the Alberta SPORU Support Unit Patient Engagement Team. And today, along with my colleagues, Dr. Marina, Rosa, Filezio, patient partner D'Arcy Duquette, our Associate Director, Dr. Paul Ferry, and our Communications and Research Support Coordinator, Amber Ortego-Pinto, we'd like to talk to you about some considerations and guidelines and reflections on creating patient partners in patient-oriented research projects and activities. So before we start, we'd like to acknowledge that we are on the traditional territories of the people of Treaty 7, which include the Blackfoot Confederacy, Siksika, Piikani, Kenai First Nations, the Tsuut'ina, Stoney Nakoda, Chiniki, Bearspaw, and Goodstoney First Nations. As well, the city of Calgary is home to the Métis Nation of Alberta, Districts 5 and 6. And so today we'll do a brief background on the CHR strategy for patient-oriented research. Marina will lead a conversation about patient partner appreciation and compensation, considerations and guidelines, mostly from the researcher and research team perspective. And then D'Arcy Duquette, patient advisor and very well-seasoned patient partner, will talk about some of his experiences and maybe some suggestions about the implications of accepting compensation on patient partners' income. And then Amber will share some of the Alberta SPORU Support Unit patient engagement supports that we can offer for working on your patient engagement budget and plan, as well as some of our co-developed resources. And then Dr. Ferry and Amber will lead a question and answer discussion period. So as many of you know, CHR is one of the major funding bodies for public health research in Canada. And in 2014, they launched their strategy for patient-oriented research, otherwise known as SPORU, establishing SPORU support units in 11 of provinces and territories across Canada to help support researchers and patient partners to work collaboratively on patient-oriented research projects. On the right is a map that can be found on the CIHR website, and it hyperlinks to each of the SPORU support units websites, where you can go to learn more about each of their unique resources, supports, and compensation guidelines that they offer. And so we're the Alberta SPORU Support Unit Patient Engagement Team. We're one of 4 teams for AbSPORU, the other 3 teams being Learning Health Systems, Data, and Capacity Development. And CIHR recently launched their Research Excellence Framework, with patient-oriented research being one of the key components of this. And the definition they offer for this is excellent research includes meaningful engagements of patients, people with lived and living experience, and other knowledge users as partners throughout the entire research process. And so patient and patient-oriented research, again, is individuals with lived or living experience of a health issue, their caregivers, family members, friends, as well as members of specific affected communities. And these can be communities in many senses of the word, including patient communities, communities sharing similar ethnic or cultural backgrounds, as well as geographical communities. And so we've heard patient engagement used many different ways, but because we are funded by CIHR SPORU, working on SPORU specific activities, patient engagement in this context is described as patients beyond the roles of participants as active and equal members of research teams. And just to help clarify this, again, patient partners are members of the research team contributing their lived experience expertise as well as other expertise, and therefore their role does not require ethics board approval, but the purpose of today's discussion is to look at ways we can compensate them so that they're not the only members of the research team not being offered compensation or training and supports. And again, participants are the ones who contribute the data to the health research project, and their role would require ethics approval. And this is a CIHR research cycle. It was developed several years ago. So our team has just identified these other places where patient partners have been asked to collaborate and contribute to research processes. And so again, determining research priorities, applying for funding, designing the study, data collection, data analysis, dissemination, and implementation and evaluation of the study results. So Marina and D'Arcy will be talking about ways to provide training and supports in these areas, as well as compensating and recognizing this essential contribution. And SPOR is SPOR work. CIHR asks that SPOR work is guided by this values-based patient engagement framework comprised of 4 principles: inclusiveness, support, mutual respect, and co-build. And so today's conversation will focus on the support, compensation, and training to ensure that engagement is equitable and meaningful for all members of the research team. So now I'll pass it on to Marina.
Thank you, Ingrid. Hi, everyone. My name is Marina. I'm a physician at the Children's Hospital, and I've been the instructor for the patient engagement and patient-oriented research for the past 2 terms. And as Ingrid mentioned, I'm going to be talking a little bit about the compensation aspect. And first, one very important thing is for us to know the difference between what's compensation, what's appreciation, what's reimbursement. Sometimes all those 3 terms, they look like synonyms, but they're definitely not. So when we talk about compensation, this is what we offer to our patient partners for their time, for the contribution that they bring to the team, bringing their lived experience as part of the research team, right? When we talk about token of appreciation, that's what you're going to be offering to your patient participants. So for the individuals, they're going to be completing the surveys, they're going to be the subject, they're going to be interviewed, and the ones that are going to be participating in the focus groups as well. So this is just a token of appreciation for their time to be helping with the data that you're going to be producing. And when we talk about reimbursement, reimbursement means when you're covering any costs that is related to the research. So sometimes your partners are going to be facilitating the focus group, so they have to need transportation from one side to the other. Same thing when they're helping with data collection. So this is something that they're going to be receiving the money back from that expense that is directly related to collecting data or contributing to the project. And that is a couple examples that we have there, such as parking, travel, or even childcare. One thing that is probably on the back of everyone's head is that not every project is heavily funded, or sometimes you have a very limited budget. So there are other ways to compensate your partners. We're going to be discussing that too. And one thing that you're going to hear me talking a few times is make sure you talk about this right at the beginning, right? Make sure this is something that's discussed up front, because you probably know your budget up front too, or at least you have a vague idea of how much money you have. So this is something that should be very honest and very transparent and discussed since the beginning, okay? Can we have the next slide, please? Thanks. Okay, so a little bit of the background. So the involvement of patients as partners or collaborator in research and healthcare systems, still something very new, still something that continues to grow, is continuing to expand. So, however, that's one of the reasons that we have sort of limited guidance on how to do that. So one thing that we see for many individuals and organizations, this is still a very difficult topic because we don't know a lot about it. And especially too, because historically, when you think about patients being involved in research, you primarily think of them as a volunteer, right? They are volunteering their time as a study subject. And it's really hard for both individuals and the system, and same thing as organizations, to detach from that image of patients being volunteers as them being partners and being part of the research team. And moreover, this is one thing that we find it really hard for the partners. They have a hard time quantifying their experience. So sometimes they find it really hard to quantify the value that they're going to be receiving in regards to compensation, especially because it's something really new, right? And this is one thing that we see the difference too when we look into the power dynamics of the group. And sometimes you have individuals with PhD, sometimes they're like the head of the department, physicians, and the patient partners find it really hard with the power imbalance. Especially as we said, it's hard for them to quantify their experience. And the same way, it's hard for them to feel that they have the authority to discuss compensation with the other individuals from the research team. Can we go to the next one, please? Okay. So as I said, we have limited guidance on how to do that. So that's why the Alberta AbSPORU unit created a couple guidelines. They are available online. I'm pretty sure we're going to be sharing the resources over email later too. So those are a couple documents that help you guide how are you going to be doing the engagement, how are you going to be doing the process for compensation. And you have on the right side there, just an example on how you can submit that compensation to, because sometimes the partners have to log in their hours, they have to specify the activities. So there's some templates available as well. Can we go to the next one, please? So one important thing is when we talk about compensation, why is that so important, right? So I'm bringing some of the data from a paper that was written by 4 patient partners. So they are patient partners and caregivers. They've been involved in research and healthcare for over 30 collective years. So they've been involved as consultant, partner, collaborator, from both being fully volunteered as being paid member of the team. So they have a lot of experience. And I thought it was very important to bring that from their perspective as well. So the main thing that they express is that patient partners and caregivers, they offer that invaluable experience, right? That comes through life experience. Same thing as skills and unique point of views as partners and collaborators to your research team. So this also demonstrates how your project can improve as a result of having their voice as part of it. So that perspective can definitely help the focus of the research in a particular topic, and it can provide more significance to the project and more significant and meaningful results. Can we go to the next one, please? One thing that they bring as well is 5 key principles that we should have in mind when considering compensation, right? Like, why is compensation so important? So as we said, like, it brings the point of equity. So there is that power imbalance, and especially when you offer compensation to everyone else in the team besides your patient partners. So you're just bringing that power imbalance in like way more extreme than it already is. So in order to promote a more equity within your group, you should be compensating every single member of the group the same way. Same thing with your patient partner, right? Another thing that's very important is the patient partners, they might have different motivations to be a part of the team. So generally, they have other reasons to be part of the project that might not be the same as the professional researcher, right? So one thing that we might not assume is that everyone has the same motivation to be there. We also have to respect vulnerability. Lived experience can come with personal vulnerability. Sometimes the partners, they expose painful, awkward, difficult, and even very intimate experience to other members of the research team in order to improve the research, right? So this should be not only respected, but also recognized and value, and compensation is one way of doing that. When we look into the commitment, when we look for research, like people that are professional research, that's their job. It's very different, the commitment that they are allowed to have when you consider the patient partners that might have other responsibilities, right? They might have medical appointments, they might have another job, they might study, they might have family responsibilities. So making the partnership compensate, not when I say payment, don't associate that to money all the time, okay? So when I said about pay compensation means like way to just compensate them accordingly. So when you make that partnership paid, you're supporting them to commit deeper to the research on the same level that the other researchers are allowed to do, right? The same way that they can do it. Same thing when we look into barrier removal. Compensation is a way of removing barrier and is a way of ensuring that you have a more diverse group of patient partners collaborating with your research. Without the compensation, we have to remember that probably only the patient partners that are capable of afford volunteer work are going to be the ones participating. So you might be excluding a vast number of individuals that are part of a different demographic, including the ones that work, and the ones that study, and the ones that might have limited outcome. Can we go to the next one, please? Okay, so as I said, we're going to be repeating this a few times. You should start this conversation since the beginning. This conversation about compensation, it's recommended that the project leader or the one that has the best relationship with the patient partners to be the one leading that conversation. Make sure that the preference of the partners are heard in regards to that. Make sure it's done in a very discreet and a very open and safe environment to allow them to feel that they have the sense of being open and the sense of being completely honest on the kind of compensation that they want, right? And this compensation can vary, can be financial payment, can be no payment, or even other forms. And I'm going to be explaining all of them. Can we go to the next one, please? So when we talked about money, when we talk about the rates, this is fresh from the oven rate. I got an example of 3 provinces, okay? But remember that this depends on the province, depends on the network that the research might be conducted, and may even depend if it's conducted in a specific university or not. So these are just a couple examples of how complex the rates can be. So when we see the difference from, I brought Alberta, BC, and Ontario. So Alberta, we can see that is recommended $25 an hour. So if you do approximately 4 hours, that would be around $100. Approximately 8 hours, that would be $200 for compensation. When we look into BC, they are at $40 an hour, but then they have some restrictions, right? The restrictions is like, it could be up to 3 hours, up to 4 times a year. And when we go to Ontario, it's a little bit of more flat rate of $40 an hour. But that changes according to the role that your patient partner might have too. So when we look into Alberta, if the patient partner is a member of a working group or advisory council or a committee that has less than 4 meetings a year, the rate's going to be $100. If it's more than 4 meetings a year, that's going to be $200. When we go to BC, it changes a little bit because it goes up to 4 meetings a year and up to $150 if it's a maximum of 4 hours, $300 if it's 8 hours. When we look into Ontario, it depends. If your patient partners are part of an advisory council, that's a flat rate of $1,500 a year. If they're the chair of that advisory council, that goes an additional $1,000 a year. So this was just a very long example to show how complex this can be. And there are guidelines available for it. I just wanted to give an example of how complex that can get. And can we move to the next one? So another thing that's very important, and I know we're going to be discussing this further with D'Arcy, is the implications of monetary compensation, right? Sometimes this is something that we forget about it, but it's very important that you look into tax implications. So an example is that any compensation that's over $500 per calendar year that is being paid by the same institution, it will generate a T4 form. So that means that your patient partners and collaborators, they should be aware of the possible taxes implications and the reporting requirements from accepting that payment, right? Same thing, if they receive the payment, that might affect their eligibility to benefits such as disability payments or even working compensation programs. So that's something that they should be aware of. And they should also be advised when considering those circumstances before accepting money. And as everyone probably know, in Canada, any payment that's related to this type of work should be declared as personal income. So hence again, there will be taxes implication. Can we move to the next one? So sometimes your partners, they may not wish to be paid for multiple reasons, right? So the research leader and the research even the PI, they should be able to determine if there is other forms of compensation or recognition that will be more suitable for the patient partners. Some examples, they can include your partners keeping some of the equipment that was used for the research project. Sometimes there was a gadget that was acquired during that research and they might be able to keep it. Make sure you ask that in advance, okay, before giving away any of the possible gadgets. So make sure you ask that beforehand. Same thing, they can be provided with academic recognition that could be done through authorship. Same thing when we look into systems that are available through the universities. This is an example from UCalgary. So if you have the UCalgary email, you can access the library. You can get access to full text papers. Same thing, access to software such as Microsoft 365. You can provide sometimes funding to attend a conference or publish a paper in an open access journal. Same thing when support for training skills might be provided. I'm going to be talking about this in a second here. And that leads to improving CV. You can also provide academic or mentorship support. There is many other forms, and those are just a couple examples that I decided to bring today. So when we talk about training, there is like multiple ways you can do that through the mentorship of a couple of papers as we're bringing right at the bottom of the slide. Same thing on the top right, we have the TCPS2, which is a free course for ethics research, something that could be added to the curriculum, to the CV later. The Educator Canada, they have very straightforward, very easy to understand videos to learn how to publish papers. So there is training available, and I'm pretty sure we're going to be talking a little bit further about this too later today. But one important thing is we have a couple considerations when discussing compensation, right? One, travel expense. We have to remember, as I said, if it's reimbursement associated to the research, that's not seen as compensation, okay? If it's a travel expense that maybe you're going for a conference, then this could be considered compensation. Another very important thing, you should not be assuming that your patient partner is going to be able to afford everything by themselves and like hope for a reimburse later. So this should be pay up front. So if you're going for a conference, hotels can be pay up front. Same thing with flights. Same thing with even having a budget for meals for the day so they don't have to keep a track of all of the receipts. Those are just a couple things to keep in mind when discussing this as a possible way of compensation, right? Same thing, when you look into your budget, make sure you include your patient partner effort and the engagement as part of your budget, part of your project, especially when applying for grants. This is something that's going to help you have money allocated for that, and it's probably going to save you a lot of trouble in the future. When we look into the logistics, make sure you know the guidelines and all of the procedures that your organization required in order to compensate your partners. Sometimes the universities have very specific templates, very specific frameworks. So make sure you know that process so you can inform your partners about it, right? Same thing in regards to taxes. Same thing when you think, when is the payment going to be sent? What's the way that the payment is going to be sent to your partners? So make sure you know the logistics behind it. And lastly, as any other instance when compensation is involved, a written agreement is highly recommended. So in that agreement, you should include all the terms, all the responsibilities, the work hours, and the rates or the kind of compensation that was agreed upon in advance. Okay. And can we please go to the last one? And as a take-home message, this table is from this paper on the left too, which was written by a patient partner. So as I said, make sure you start that conversation since the beginning. Make sure you're as transparent as you can possibly be, and make sure you discuss with your partner their preferences, even in regards to how they want to have this conversation. Do they prefer to do this over email? Do they prefer a phone conversation, video conference, in person? So ask, what do they prefer? Okay. Be prepared, know the logistics, know all of the requirements that the university or the institution or the network that this research is taking place. Know that so you can inform them properly. Confirm their choice. As we said, compensation is not only money that can be seen, that can be done as authorship, gift card. Sometimes if they prefer to not receive compensation, is there any other way that you can recognize them, that you can acknowledge them? Make sure that the authorship or the acknowledgement, if they want that, because sometimes we assume that everyone wants to be a co-author, but you might be doing research in a condition that is stigmatized, so something that your patient partner might not have their name exposed or might not want to have their name published. So make sure you ask that. And as I said, take care of details, be mindful when doing this. It's a very complicated, it's a very delicate process that being upfront and being transparent, I feel it's always the best approach. And that was it from me. And I'll pass the baton to D'Arcy.
Afternoon, everybody. I just every time we talk about compensation, I just worry a little bit that we're going to hurt ourselves with our tax brackets. And so, as Ingrid and Marina have already said, patient, family, caregivers, patient researchers, patient partners, voice is very important. It's incredibly important in our system and in our healthcare system to the success of our healthcare system. So a lot of people can't afford just to take time off work, can't afford to miss opportunities. So there's a compensation. I think compensation is very necessary in our system, but I just worry a little bit that we're going to impact our own personal taxes. And so the reason I want to talk to you today is just to let you know that we got to be very careful. So just a couple of things. CRA, Canada Revenue Agency, is an agency. It's not an association. It's not a committee. So agency means they got a lot of teeth, and they can go after you financially. So they can hurt you. So you got to be honest with them, and you got to be upfront. And so we have ceilings in what expectations are of people's earnings. And like, if you're a single person, you $33,000 and less, or a multiple family of either a spouse, children, it's $43,000. So that is the maximum you can earn without paying taxes. And so anytime you're issued a T4, T4A, there's a ton of T4 systems that give you, they're for pensions, they're for disabilities, all kinds of different things. And the only one that's not a T4 is a T10, and that's if you get in an argument with CPP about when you're supposed to get your money, they always seem to take a long time to produce, and then they'll issue a T10, which means that you're going to pay taxes all that same for that amount of money over the years that you've been arguing with them in 1 year. So just be cautious of that. But pensions are taxable. If you get multiple pensions, they're taxable. And what I worry about is, so we have a lot of really good programs in place, like Alberta Assist Living Subsidy Program, the Senior Financial Assistance Programs, Blue Cross benefits, disability payments, WCB. And just one example of that, so old age security, if you exceed that $33,000, they actually take away the majority of your dental benefits. So that is a huge impact. If you go to the dentist every 6 months or every 4 months, that's a big hit to you. So you got to be careful of that. And as Marina said, if you make $495 from one agency that you're volunteering for, you're okay, because you won't get a T4A for it. But if once you exceed that $500, you're going to get slips for it. All pensions earnings are taxable. Don't forget that. I think the other one that I just want to make sure that you understand is when you withdraw from an RRSP, that is also now taxable. So it goes as same as a T4 slip or T4A, and you'll actually get a slip for it indicating that you made that withdrawal. But I don't want people to confuse tax deductions. Once you establish what your taxes are, there's a bunch of deductions that you can have on your taxes, such as overpayment of employment insurance or Canada pension overpayments, different payments that are made in error during the year by your employer or somebody that you contracted for. And those overpayments, they are actual money that you shouldn't have paid, so they're called tax deductions. when you look at your medical expenses, different stuff like that, you're allowed to take off your taxes. Those are called tax credits. For a tax credit to kick in, you have to earn the money to establish the credit. So you got to be very, very careful with that. And the other thing is once you exceed that, if you are fortunate enough to be working and you're making $53,000 or less, you're a 15% federal tax, 10% provincial tax. But once you exceed to $54,000, your tax bracket jumps up to 20.5%. And the more you make, the higher your tax bracket jumps up. But there's also penalties. I shouldn't call them penalties, but there's additional taxes that you have to pay on top of that. So just be very, very careful with what you're accepting for compensation and how you're accepting the compensation. The other thing I'll tell you is CRA, well, there's lots of tax return companies out there that file your taxes, but just remember they're a vehicle to file your taxes. They're not there to protect you. They file what you tell them to file. They that's the only information they have, and that's how the systems are set up. So you're responsible for your accuracy of your taxes. CRA has a sign-in program, which is very good. It's actually fairly user-friendly, and it's I volunteer to I work with a tax software company as a volunteer, and I beta test a lot of their front ends to make sure that they're user-friendly. So CRA was involved in a lot of the stuff we do, and CRA has a very user-friendly system. And when I say user-friendly, if I can sign into it, pretty sure most of you can sign into it. But as Marina said, reimbursement of personal expenses is not taxable. Gift cards are not taxable. And remember, when you have reimbursement of expenses, so mileage, hotels, food, all that aspect of what it costs you out of your pocket is reimbursable. But if you haven't earning anything associated with that, you'll be taxed on it. And then the other thing too is tax. We go back to tax credits again. So T2200's system is all tax credits. So that's after your net income. So your net income is key here with what you're doing. And it's an easy way to figure out what your net, well, actually, I would say that the best way to do this is if you get your paycheck every week or every 2 weeks or every month, depending on when you get it, just take that gross number. So there's two numbers on your check. There's a number that you got paid, and then there's a number that went into your bank account. Completely different numbers. So that the gross number on your check, take that and say you get paid monthly, take that, multiply it by 12, and that'll give you a really clear understanding of what your earnings are going to be for that year. So just the only reason I want to talk about this is I see a lot of people that jump from one tax bracket to another tax bracket. And for example, if you made an extra $1,000, it could have an impact of $3,000 on your taxes. So just be careful where you are. And the information that I'm giving you is very easy to obtain on the CRA website. It's you can ask for T4 or tax submission, and also on the provincial government, there's it's income tax and return benefits form that you can ask for, and it's simple to look it up, but it's very, very complicated the way they write it. So I'm not telling you that you can hand bomb your own taxes. I'd get a software program with it because it asks you lots of questions to keep you out of trouble. But I think it's very important to recognize that there is an opportunity here to impact your taxes. So be very, very careful when you accept compensation and the method you accept it in. And this is not a tax evasion program. And if anybody gets in trouble, Dr. Ferry's name is available to submit.
Thank you, D'Arcy. Thank you, D'Arcy. And so just before we go on to Amber, I just want to quickly recap then. that patient partner compensation is the money you get, or the money that you are offered if you would like to accept it, for your work on research projects, and it can vary across the different SPORU support units and SPORU funded entities from $25 an hour to $40 an hour. It's important to have the conversation up front. If you earn more than $500 in a calendar year from the same institution, a T4A slip will be generated. So you could earn $490 from the University of Calgary funded project, and then perhaps another $250 from an Alberta Innovates funded project. Neither of those will generate a T4 in a calendar year. So up to $500 January 1st to December 31st will generate a T4. And D'Arcy's suggestion is that you're just cognizant of this when you're accepting, especially if you're doing larger projects, that your income category isn't going to be affected. Also, reimbursement is for expenses that you've incurred. So if you had your conference paid for, or you were traveling by plane, those costs would not be taxable. If you were given a per diem for your meals during a day, that would not be taxable. That's a reimbursement of an expense. And so if you are working on a project and you are concerned or confused, please reach out to the patient engagement team, or reach out to your accountant, or reach out to somebody that you trust, maybe multiple people, just so that you don't feel rushed into making a decision that's going to impact you later. Also, remember that research teams this is new to research teams as well. So it's really important that you share your concerns so that we can all learn together and move this forward in a meaningful and positive way for everybody. So now Amber is going to share some of the resources that we've co-developed to support the science, practice, and art of patient engagement and patient-oriented research.
Thank you, Ingrid. Hi, everyone. I'm Amber. I'm the research operations assistant with the patient engagement team here. Nice to see you guys all here. So yeah, we're just going to go over a little bit of the resources that we can offer. One of the best ones is the website itself. This is where we share current events, the course offering, resources, and support services. Thank you, Ingrid. We also have some free courses online that you can start at any time, and we have training modules. And we also have courses that you can request, and one of our team members can do with you and your team and your patient partners. And that is on the website as well under course and training modules. As the patient engagement team, we can help you develop patient engagement plans and budgets. So if you feel a little overwhelmed, just contact us and we're more than happy to help you. We can review and provide feedback on patient engagement aspects of grant applications and project proposals. We can help you recruit patient partners. We offer capacity building and training opportunities to both researchers and patient partners, like mentioned before. There are resources for offering and managing patient partner compensation and engagement, including templates and guidelines that are on the website, and we can also send it to you via email. We also help with evaluation of patient engagement for projects and activities. Thank you. We do have an accelerator award, which is a one-time award up to $500 to support early patient engagement efforts of students and early career researchers. It is intended to cover some compensation, hospitality, expenses to support the engagement of the patient partners in your research. It does require a patient partner engagement plan and budget, but like I said, if you don't have that, we are happy to help you create an engagement plan, and then you could apply for the Accelerator Award. Just reach out to our team to get the application form and support to develop if you'd like. We also have a journal club. We had one actually yesterday. It was being a sibling of child with a neurodisability. It will be available on Vimeo and YouTube if you did miss that. It is monthly, so we welcome all researchers, students, patients, and general public. And yeah, we look forward to seeing you. Our host is actually here right now, Sadia. She is the one who hosts this event. We also have a podcast called Pep Talks. It's on SoundCloud, Spotify, Apple Podcasts, anywhere you listen to podcasts. The host is one of our team members named Sandra. And she has discussions with patients, families, community researchers, academic researchers, clinicians, policymakers, stakeholders, you name it. It's just to focus on partnership and patient-oriented research and patient engagement in health research. So if you want to learn more and listen to other people's journey within the patient engagement community, yes, please look and listen to the podcast. It would be a really good resource. We also have albertansforhealthresearch.ca. This is where we post all the patient partner opportunities. Here on the right is a patient partner opportunity, what it looks like. It'll give you the background, roles and responsibilities, time commitment, compensation, and then below there where it's cut off there is contact information usually with the email or phone number of the researcher. And then on the left here is just the list of opportunities that you can click on. If you do go there, you scroll down, there's a lot of resources that Ingrid has placed there that are very useful and links. So you can also visit albertansforhealthresearch.ca if you are looking for opportunities. We have the PACER program, which Ingrid is an instructor of. It's basically an experimental learning certificate designed for patients and offered through the University of Calgary. And if you guys want to connect with us, we have multiple ways you can. So we recently relaunched our Instagram, so please make sure to follow. We'd love to connect with you guys. If you have any opportunities that you want us to share, you can contact me. I'll put my email in the chat. We'd be so happy to collaborate with you guys and spread the word about your opportunities. We are on X and Facebook, LinkedIn, YouTube, and Vimeo. So we're everywhere that you need to connect with. So in conclusion, patient engagement is a powerful way to improve research outcomes, make research outputs more meaningful to patients, and to strengthen health systems. There are many different ways and approaches to integrating patient and lived experiences, expertise into your research project, processes, projects, implementation, evaluation, plans, and dissemination. You're not alone. There's lots of resources that exist. We're here to help. If you can't find it on the website, you can always email Ingrid, Paul, Marina, D'Arcy, all of us. We have loads of resources, so don't be afraid to connect with us. So I'm going to stop recording now. So